So once we've thoroughly trained our patient on multifidus contraction, both their initiation of the proper movement and contraction techniques, we've progressed through stage 1 and stage 2, then we can start going into stage 3, which involves both the lower extremity and the upper extremity. These are what most people refer to as the bird dogs. But there's a lot of intricacies to this maneuver that quite a few people do quite wrong. So we have to make sure that we train this very carefully. So, Alana, the first thing I want you to do, we're going to go back into that pelvic tilt, a little bit of that swelling of the spine, relaxing the thoracic, drawing in the lower abdominals. Okay, want to make sure that she keeps her body forward. Okay, so we want equal weight right now on the knees and on the shoulders. Okay, while your pelvis is nice and tight here and we're fixed, I want you to just elongate up on the leg, and we're going to use the contralateral arm. So we're going to bring that thumb up right here. Okay, so we're going to make sure, we're going to need a lot of cueing here. We're going to make sure she keeps that pelvic tilt, keeps the leg in neutral rotation, plantar flexion. Okay, swell up a little bit more here. Good. So you can even cue her there. Okay, you can cue her to palpate on that TA, and we can also kind of fix her on both her pelvic structures on each side, both her innominate, and make sure she's not medially or laterally rotating. All right, that's really important that she doesn't tilt. Okay, and relax back down. We want to start with just 5-second hold time. So let's go to the other side. Okay, pelvic tilt again, perfect. Okay, drawing in the lower abdominals, bring up that leg. So she's actually rotating a little bit on this side so we can see. So we want to cue her to rotate back to that internal. Okay, so she keeps a level spine. Okay, we want to cue her to shift her weight forward a little bit to make sure we're engaging the core even more so she doesn't compensate with her glutes. I want to make sure this arm is fully up and extended and she's kind of stretching out and elongating. So we're pulling up, pulling that spine. And switch again for me. Okay, let's go one more on the other side. Pelvic tilt, drawing those abdominals. Okay, extend, neutral rotation, full extension of the arm, elongate. So the purpose of this arm extension, we're getting a lot of that lower trap, especially when we have that thumb up. That's important. We get that lower trap to help stabilize the spine here. So we're getting the multifidi, the transverse abdominis, the lower trap, and we're trying to eliminate the glutes from firing. So again, always cue her to shift forward. Good. And back down. So we want to start with about 5-second holds, progress to 10 seconds, even 20 seconds, alternating sides. But cueing is very, very important in this exercise. So make sure that you thoroughly train your patient on how to perform this properly before you just send it to a home program for them.